I am Christy Sherman, and I'm a psychologist over in the Young Civilians. I work with the MS Center as well as some of the other groups there. And I am happy to be here to talk primarily about sex. I was glad when this program was put together. I think there are some important topics that people don't always talk about. So just basically, I'm going to talk a lot about relationships and intimacy. And I'll start out by talking about what kinds of things can go wrong with sexuality in MS. And then I'll spend some time talking about communication, because that's a really important part of this. Many factors can influence relationships. Sexuality is one of those. We are sexual beings, whether or not we're in a sexual relationship or behaving in a sexual way. That's really a core part of who we are. And so I think it's an important thing to address that we don't always bring up and we're not always comfortable bringing up. So again, another reason that I'm glad that we're having this talk today. And coming into MS, you had your own strengths and weaknesses. Relationships have strengths and weaknesses even before you had MS. So MS can add another layer to who you are, how you see yourself, and to your relationships and how you relate to other people. So we'll talk about intimacy too. So there's more to intimacy than just the physical sexual relationship, but it's also that closeness that occurs within a relationship. So the World Health Organization defines sexuality as being a part of everyone. And the point here is that having a chronic illness doesn't make you non-sexual. And sexuality involves a lot of different parts. It's not just about the sex act, but it's about how you see yourself, your body image. It's about how you relate to other people. And there are a lot of emotional factors involved in being a sexual person. Unfortunately, sexual challenges are pretty common among people with MS. So at some point in your lives, 75% will probably have some challenges related to sexuality. But again, going back to what Dr. Plaskin said, what's common is common. In the general population, 30% of men and 40% of women also experience sexual problems at some time. And this varies considerably with age. So these numbers are higher as we get older. Things just don't work in quite the same way anymore as we get older. So the term sexual dysfunction is a little unfortunate. I'll usually say the word problems or challenges, but that's the clinical term. And they can be divided up into primary, secondary, and tertiary problems. So because of the direct effects of MS on the central nervous system, there can be some challenges with sexuality. And then the secondary problems are more of the indirect effects of some other symptoms that are related to MS, or side effects of medications, unfortunately, can have sexual side effects. And then the tertiary problems sometimes are the most important, and that can be anxiety about sexual function. It can be depression. Sexual problems of reduced interest can be a symptom of depression. And also just the attitudes and messages that we get about sexuality. So here, what can go wrong? Decreased arousal or interest is also called libido. Some people describe it as just the switch was turned off. It's just not, the oomph is not there anymore. For women, changes in vaginal lubrication or engorgement, just how much blood is getting to the genital region, can be a direct effect of the disease. For men, reduced ability to get an erection or to ejaculate, that can be a change that's a direct effect of the MS. Also, there can be a lot of sensory changes. People might have paresthesias or differences in sensation so that things don't feel the same. Sometimes people are really sensitive in certain areas, including their genital region, so being touched isn't pleasurable like it used to be. And that can be a tough change to deal with as well. And we've talked about some of these already today. Bowel and bladder symptoms certainly can affect how the behavior, sexual behavior, but also how you feel about yourself sexually, and can cause embarrassment sometimes too. Spasticity can affect how comfortable sex is or what positions are possible, which can require some creativity and some flexibility, and also communication with your partner, which I'll talk a lot about at the end. And lastly, we've alluded to this already today too, is that medications can have side effects. So some of the bladder medications can cause some sexual side effects as well. And also cognitive changes. We haven't mentioned this today. So to get aroused, to have sex, to be involved, takes a certain amount of attention. And sometimes folks with MS, their attention is not quite so good. And that can affect sexuality and the ability to kind of stay with it and to get aroused and to have an orgasm. And so, of course, anxiety, changes in self-esteem can happen. Body image can be different when somebody has MS or has a chronic illness or has mobility changes. And so many of these things can be impacted by MS. And also there's a lot of myths, a lot of attitudes that we have that can interfere as well. So sometimes these barriers can be the most challenging. And, you know, a lot of people feel like, well, it's just not the same. And, well, yeah, it's not the same, but can you figure out a way to make it okay or to kind of work through it so that you can still have that rewarding part of your life and express that part of who you are? So now what to do? First of all, talk to a provider. And there are a lot of healthcare providers who are more than happy to help with sexual challenges and try to sort out what's what. Some people say, well, what provider do I talk to? And frankly, there can be a lot of different of your providers that can help you with these sorts of problems. Sometimes a primary care provider can at least get the ball rolling. Talking to your MS specialist, going to a urologist or a gynecologist who deal with this stuff all the time. There's nothing they haven't heard probably. And so whoever you feel comfortable with bringing this up. Physical therapists. You know, I've worked in settings where somebody is really comfortable with their physical therapist and they bring it up and the physical therapist is happy to work with them on talking about different positions. Oh, well, you have back pain. Well, have you tried this position? Or, oh, you have spasticity. Have you tried this position? And so sometimes even a provider that you may not think of first as someone who can help you with sexuality can actually help you with sexuality, and you don't know until you bring it up. So treatment for some of these sexual challenges, you know, what to do now, and that's what this is all about. You know, what do you do? And talking to your doctor, talking to a healthcare provider first is really important because I haven't talked about it on these slides, but there may be hormone changes. There may be other things that are treatable that don't have to do with your MS, that a healthcare provider can do some tests, might be able to try some things out to help you figure out what the solutions might be for your particular issues, which may or may not be related to MS, but you don't know until you look into something. So for erectile dysfunction, which is a very common problem, and we hear about some of the treatments all the time on television. The medications have been around for a while now, and so they've been widely used, widely tested. There's multiple options for medications. Dr. Plaskin alluded to the injection, a penile injection. So it's an injection you would inject yourself into the penis, which produces an erection. Which is different from the medications. My understanding is that the medications, you still require some direct stimulation in order to get the erection. You're not going to automatically get an erection with taking the medications. Penile suppositories and implants, and also for some men, a vacuum pump. So pictured here, it's also called the the tube. These are available on Amazon. They're available online. And what it does is it creates negative pressure to try to draw the blood into the penis and produce an erection. So that there are a lot of options for erectile dysfunction these days. But again, good thing to talk to your doctor first and make sure that there's not a medical issue that's important to address that could be causing that issue. And for some of the issues that come up, you just have to experiment. It's not always, the problem is X, the treatment is Y, there you go, all better now. But a lot of this is trial and error and being willing to experiment. So, sex toys. There's a lot of sex toys out there. Vibrators can be very useful, not just for women, but for men and for couples. And so there's a store in Seattle called Babeland. It's been around for a long time. I've worked with a lot of folks with chronic illness or disability who have gone there or talked to them on the phone and say, wow, they were really helpful. I told them what my issues were, and they made some suggestions. I was able to buy some things, try them out by myself or with my partner. And what do you know? They've seen an improvement in their sex life. So I'd encourage you to let go of stereotypes or pre-existing attitudes and be willing to try some new things that might help your sex life. Body mapping is another way to explore and try to find some things that are enjoyable for you. And this body mapping refers to preferably at first by yourself. Just kind of explore your body. And this is not just, masturbation and genital stimulation, but really, touch different areas of your body. You might find that sensations are different than they used to be. Things that used to be enjoyable may not be as enjoyable. Things that used to not be enjoyable maybe now are more erotic or more enjoyable. But to try this out by yourself, maybe try it with a partner, and especially if your goal is not initially orgasm or intercourse, but just to explore, just to touch, to try things out, to see if maybe you find some things that are pleasurable that perhaps weren't before. So, one challenge for folks with MS is fatigue, and that touches all areas of life and certainly is an issue when it comes to sexuality. And some patients I talk to are just so tired. It's like by the end of the day, oh my gosh, and how sex really, it's just trying to get through the normal course of the day is difficult, and to figure out how to maintain a healthy sex life is pretty daunting. And so being willing and open to some practical problem solving. Okay, how can I conserve some energy for this part of my life? Is there a time of day we can schedule a sexual interlude? Could I work on timing my medication so that my best energy is available for this part of my life? And then certainly to figure out things like anxiety and body image and how you feel about yourself as a sexual person. You can explore this on your own. You can try to gather some information. But also sometimes individual counseling, psychotherapy can be a good idea, not just specifically for the sexual piece, but for the grief, associated with having a chronic illness that can come up, for your body image, for self-esteem, for how to best communicate what your needs, what your wishes are. Finding support from support groups can be useful. And yes, the largest sex organ is the brain. I've read that at last count, 14 different areas of the brain are at work in sexuality and in sexual behavior. This also means that how we think and how we feel really has an impact on how we function sexually. And communication, obviously is really important. A lot of sexual behavior does take place within the context of the relationship. One thing I recommend to a lot of couples is that you rethink the the sexual relationship. You know, and this happens for people who don't have MS as well. There are a lot of reasons why people have sexual changes as they get older or with other kind of conditions. But how you express affection, how you, what your expectations are about touch, about closeness, about intimacy, and to really look at some of the potential barriers. Some couples find it useful if they both attend appointments and can get information together from a professional. Sometimes it can be useful to share written information and both read it and then talk about it. The MS Society, for example, has this pamphlet, Intimacy and Sexuality in MS. I know we have some of these in our clinic. You can also read this online. It's not just in paper form. And sometimes reading it, you might take some notes, share it with your partner, and then that can be an easier way to bring up some of these topics. And communication is not just talking, but listening and really trying to listen to what your partner has to say. Sometimes we make assumptions about what our partner may think, and we could be wrong. And so you're opening up the lines of communication so that you are eliciting information as well as trying to share some information with your partner. And sometimes scheduling time to talk. Sometimes we intend to bring something up with our partner, but life goes on and we realize, gosh, I meant to talk about that weeks ago and still haven't. But saying, hey, honey, why don't we have some quiet time where the phones are off, the TV's off, and we can just talk about our relationship. And also to see this as a series of discussions, so that, opening up the discussion, it doesn't all get resolved in one go. It's usually a series of discussions for any important issue in a relationship. I also find, having some basic techniques in your back pocket can be helpful sometimes. But I like the sandwich technique, that if we're going to ask someone for something or to change their behavior, if we start off with a compliment, like, boy, I really liked it, when you, gave me a kiss and a hug the other day when you got home. Do you think you could do that more? To try to sandwich that request rather than saying, well, gosh, for once you came home and gave me a kiss and hug. Why don't you do that more often? Or, putting the other person on the defensive. So starting off with a compliment, asking for what you want rather than complaining about what you don't want can be useful as well. So lots of ways to get help if you're having some challenges with relationships in general, with sexuality. Talk to your healthcare providers. Try to get a referral for individual counseling or psychotherapy, or couples therapy. There are a lot of great couples therapists out in the community, and also there are sex therapists whose training and specialty is more specifically on sexual behavior. And I mentioned this pamphlet that is on the MS Society website. And then Sex Ed for Grown-Ups, Intimacy and MS, is a recorded lecture, as much sort of like we did today on the MS Society website. So if you go to the National MS Society and you search Sex Ed for Grown-Ups, it's an hour-long recording. There's no video, it's all audio, but there's useful information there, and that's something also you could listen together with your partners. If you and they are interested in that, for some more resources. So just to conclude, obviously MS affects every area of your life, and at some point it's likely it's going to affect sexuality, but there are a lot of opportunities to find solutions and to really bring this up with your healthcare providers. They have heard about this stuff before, and hopefully they can help you feel comfortable in bringing it up as well. And treatments can target directly some of the physical symptoms, but also some of the more psychological or relationship areas. Thanks for your attention. Thank you.